Yay. All right, everyone. Thank you so much for coming to episode 6 of Behavior Bites. I am really, really excited to be here today with Dr. Amy Learn of Richmond Animal Behavior Wellness Center. Dr. Learn is a veterinarian specializing in behavior and has been a veterinarian for over 17 years, specializing in vet behavior for the last 4. Dr. Learn is on the board of the IABC Education Foundation, gives lectures at conferences around the country on veterinary behavior, writes blogs and journal articles, and contributes to textbooks, and just is a wealth of information that we are so fortunate to have right here in Richmond. I don't know that folks always appreciate how cool it is that you're here. Thank you, Dr. Learn, so much for being here. I am so excited to talk with you today.
I'm excited too. This is so much fun.
Awesome. So let's jump right into it. We're here to talk today about the intersection of the veterinary field and behavior. And it's such an important intersection. There's huge overlap. I'm so excited for this conversation. So what is a veterinary behaviorist?
So that's a good question because not everybody knows. There are a lot of people that say, I'm a behaviorist, or I need to see a behaviorist, or I saw a behaviorist. And really, there are a few different versions of that. There are applied animal behaviorists that have a PhD, maybe even a master's, I think a master's or a PhD in animal behavior, but they aren't veterinarians necessarily. Some are overlap. Then there are a lot of behavior consultants out there that are fundamentally trainers. Some trainers do call themselves behaviorists, and so you have to kind of walk that line and decide who knows what about what. A veterinary behaviorist is really a licensed veterinarian who has graduated from a recognized college of veterinary medicine and has completed at least 1 year of an internship in specialty, lots of different types of specialties. So internal medicine and surgery and dermatology and cardiology, and knowing all of those kinds of different facets of veterinary medicine, or has done at least 1 year in primary care practice. I've also undergone additional behavior specific training and residency, and that's 3 years of case supervision by an established specialist conducting an original behavior research that has to be good enough to be published in a peer-reviewed journal. You also have to author 3 formal case reports that are approved by a review committee of diplomats, and that's really rigorous and difficult to do. And then you have to pass a 2-day board examination. So part of the training for a veterinary behaviorist includes sociobiology, psychology of learning, behavioral genetics, behavioral physiology, psychopharmacology, all the medications that includes, ethology and behavioral endocrinology for all species. So mice, lizards, cats, dogs, birds, elephants, wildebeests, you name it. I have to know everything about everything.
Wow, that is an impressive list. I feel motivated just hearing. I'm like, yeah, let's go learn some stuff. Like that is wow. So to say that a veterinary behaviorist, it has a very well-rounded understanding of what, all of the factors coming together to explain this being's kind of existence, right? Every facet of that, I can't get more specific than that, is not an understatement. I mean, that is, you are the person to go to.
We have to know how the whole brain works, everything that goes on in there.
Yeah. Oh, okay, so I'm geeking out, right? But how do I know if I'm the average pet parent, how do I know if I need a veterinary behaviorist versus a behavior consultant or a trainer? We don't have to get into all of but how do I know if I need a veterinary behaviorist?
Sure. And so I think that sometimes people feel like they have to get to the end of the line and it's the last resort to come to see a veterinary behaviorist, but that's not always true. So sometimes even referral to a behaviorist means the difference between euthanasia and a positive long-term outcome. And if the sooner, just like any other thing, the sooner that you get help, the easier it is to change that projection and to help that animal to, I don't like to say fix, because it's not even that those animals are broken. Certainly something is wrong and we want to change the way that they think about things. And obviously the longer you've practiced a bad habit, the harder it is to change that habit. So even puppies and kittens that are referred early in their, as soon as somebody figures out something's maybe not quite right, they have a better chance to have a shorter course of treatment and have a more positive outcome. We can kind of put them on the right track. And I like to even think about that as, when I see puppies and kittens that are really early on, their brain is still developing. And so if I have a dog that's been doing something for 6 years, I can't really cure you. I can't fix that, but I can help you choose a better way to do things. For puppies and kittens, since that brain and those pathways are still connecting and developing, if we get involved early on, I can actually fix that. We can make the brain change that pathway, and we can really mold that development so that everything goes back to normal, right? Nobody likes to say normal, because what does that even mean? But back to the way that it really is closer to normal, is closer to the way that it should be.
Yeah.
And some people are worried about, the cost of evaluation. And certainly anytime that you have to have a specialist involved, those costs are more expensive than going to the average veterinarian. But the good news about behavior is that it's often divvied out over a long period of time. It's not so much like surgery. And I don't mean to throw the surgeons under the bus, but you go to have surgery and it's several $1,000s all in one day, and there you go, and you're out and you're done. And so for behavior, it's modified over a period of time, because it's not something that you can fix right away. You have to do this chronically and help this patient over a period of time. Some things that I like to consider as far as how or when to decide to see a behaviorist is when the patient has been resistant to reasonable first-line treatments, or if the pet parent is threatening to euthanize or relinquish that pet. They're at the end of their rope. They've been dealing with this for a long time. They're overwhelmed. If the pet is at risk for self-injury, right? Some of my patients have compulsive disorders or self-mutilate, and that is dangerous. Sometimes even separation anxiety cases can damage themselves by trying to break out of their home through windows or chewing things and destroying things. If the pet is aggressive towards people in the home, and especially if there are high-risk individuals, children, elderly, we want to make sure that everybody is safe. If the pet parent, or if the pet is aggressive and the pet parent is not maybe managing or isn't as compliant as they should be to keep everybody safe, that's a very high risk for not only family members, but the community. And if the primary care veterinarian has exhausted all of their knowledge and they've done everything that they can and they don't know what else to do. And then again, like I said, puppies and kittens who are moderately or even severely affected, sometimes there are some lemons out there and they just need help right away.
Unmute myself there. Absolutely. Oh, that's such a great way. I love the way you flow through that. And it makes me think it kind of hits all of these marks of the responsibility that we have to the dog and their well-being, the responsibility we have to the well-being of the people in the home, in the family, right? And to society, right? And so we're looking at how each of those things are impacted and in saying, when is it time to elevate this? So I love that. And you brought up two really good points that I just kind of want to say back and reiterate that I see sometimes when I am recommending that I have a client come see you. One is that you are not replacing their general practitioner. I have some folks who rightfully love their vets very much, and their immediate biggest resistance is, but I love my vet, I don't want to leave them. And I'm like, no, she's not replacing your vet. She is a specialist. This is like going to see any other specialist. Your GP is still your GP.
Absolutely. We work as a team, right? Everybody works together.
Yes.
And this is a judgment-free zone. I don't care what you've done, good or bad. I don't care if you think that you're a terrible pet parent or your dog is evil or what have you. None of those things are really true. Those are just labels in your brain. And so the trainer, the primary care veterinarian, the family, and the pet, and we, and us, and I, and we all work together to make sure that we have the best positive outcome.
Yeah, it really is. And I think people in by the time a lot of times they've been dealing with behavioral issues, or they're very scared, they've just started noticing some. There's guilt, there's shame, there's embarrassment, there's fear, there's all this unknown. A lot of times things seem very unpredictable. It's so nice to suddenly have a team and to
Absolutely.
have a team of folks that want to support you. So yes, I love that so much. And then the other thing you said was around frequency of visits. And I think that's something that I didn't realize was occurring to my clients sometimes too. And they thought that they would be seeing you as often as they were seeing me. And they were like, I don't know, is this really something we should do? And then it's like, no, this is how this works. You're coming to see Dr. Learn to do an initial assessment, right? I mean, your forms are very, very detailed, right? You are gathering a lot of information. You're running a lot of diagnostics. You're gathering a lot of information during that initial session. It's really, I think, just hugely helpful, hugely helpful. Okay, I'm going down a rabbit hole, but hugely, amazingly important for any clients that that I've had the pleasure of sharing with you. And just so folks, if you're experiencing any of the things that, if you were listening to Dr. Learn's reasons for who needs a veterinary behaviorist, and some of that resonates with you, absolutely reach out for more information and for more support. Okay, so that being said, before I just go down my own rabbit hole answering the question, what is the process? So a client is interested in reaching out. What happens next?
Absolutely. So, many specialties need to have the primary care refer a case, and they won't see anybody without that referral letter. And that is wonderful. And this is not that I'm going to cut any primary care veterinarians out of the loop. I always contact them and tell them what's going on, but it doesn't have to be precipitated by their regular veterinarian. Referrals can be made by the vet or the trainer, or the clients can even seek us out on their own. And maybe they haven't fully informed their veterinarian about what's going on. And so they don't even know that the animal's suffering or having trouble. And so if clients reach out and find me on my website and contact us, we send them a questionnaire. Well, first of all, we send them an email that says, this is the story, this is what to expect. Here's your giant questionnaire form. Please fill that out. And we then contact their veterinarian to get all of the medical records so that we know what this pet has gone through, however long that they've been seeing that veterinarian, and are there any medical issues that might be contributing, or what medications that the pet is on, making sure everything else is healthy. After all of those documents have been received, we schedule an in-person appointment to see that client and meet their pet. And that appointment discusses factors that have contributed to the current problem. And then we make diagnoses and figure out a treatment plan that's appropriate for everybody involved. We also send our letter back to the client, summarizing everything that we've talked about so that they have it all in writing, and to the veterinarian and trainer so that everybody knows exactly what we've talked about and what our plan includes, so that we can use that team approach.
Oh, I love that. I love that. I love the support that comes with it. I feel like there's just like there can be such a relief to it. So that's fantastic. So people come in, they're full of hope. They have a support team now. What does a successful resolution look like? I think sometimes that can be really intangible. And I think, often part of our jobs is creating some tangibility. What do you want this to actually look like? We know we want this to stop, but what does that look like? So what is a realistic, successful resolution for some of the clients that come to see you?
I think that really varies from patient to patient and household to household, because everybody has different expectations in what they want from their pet. And also, we have to, again, consider what the pet is going through and what is okay for that pet as far as quality of life. Some of my patients are extremely anxious, and the owner wants to take them to, the Little League baseball game. And that might be fun for the family, but not fun from the pet ever, even if we help them, right? So we have to be realistic in what can we achieve. And so, treatment is a very slow process, because we work with the learner, the pet, at their speed. We don't want to push them too fast, because faster isn't better. We have to make sure that we're comfortable every step of the way. So we help them modulate their own emotions. We develop better coping skills. Life is stressful. It doesn't mean that anybody's going to be in a bubble and nothing bad is ever going to happen again. We have to, face reality. But if you're set up to manage those stresses correctly, it doesn't have to be awful all the time. And so stress still happens. We just want you to be able to cope with that stress a little bit better and choose more appropriate responses when you're faced with stress.
Yeah, and that's, I think true for the dogs and the people, right? So I hear a lot of times clients will say, well, I'm just so relieved that I know what to do in this moment now. And the dog is feeling that same relief. Oh God, I'm just so relieved I know what to do in this moment. And we've gotten the brain to a place where it can learn things like that. And yeah, we're going for progress, not perfection. I read that somewhere recently, and
Mhm.
gosh, can't think of who to attribute it to, but
That's a perfect quote. Yeah.
it absolutely is. Yeah. Yeah. Dr. Lauren, thank you so much. I feel like we could talk forever.
I know.
You'll have to come back and talk some more soon.
Mhm.
Um, Before we go, what do you want folks to kind of take away? Do you have a call to action for us? And where can folks find you? And I'll put all of your information in the description as well. But
Sure, absolutely. So you know where to find me. I'm at the Animal Behavior Wellness Center. The address is 1130 Wilkinson Road, but really it's better to find us online. So abwellnesscenter.com, or even emailing us at richmond@abwellnesscenter.com. And really what I want people to know is this shouldn't be your last choice. The sooner we get involved and become part of your team and your family, we can help your pet respond a little bit better. And this is for primarily cats, dogs. We do see sometimes birds or smaller mammals, but really it's all of the problems that could possibly happen. So anxiety, aggression, separation related problems, elimination problems, dementia, and cognitive changes later on in life. Um, Everything that you can think of, we can help with. And so just reach out and let us help you.
that's beautiful. Thank you so much again, Dr. Learn. I really appreciate you. And thank you everyone for listening. I hope you've gotten some insightful information today. All right, goodbye.